Right now, we are seeing more young Nevadans experiencing mental health crisis due to many different stressors. There are instances when it becomes clear a minor might not be safe, whether they are at risk of harming themselves or others. In these rare cases, a mental health crisis hold may be necessary until a parent or caregiver can be reached to participate in treatment planning to manage the mental health crisis. By the end of this short educational video, brought to you by the State of Nevada, Division of Public and Behavioral Health, you will have a better understanding of Nevada's process for caring for a youth who is experiencing mental health crisis and needs personal protection. A mental health crisis can happen to any child or youth, and when it does, it can be scary and confusing for the minor experiencing the crisis, for parents, caregivers, and for professionals who don't work with mental health crisis on a day-to-day basis. Sometimes, youth aren't able to keep themselves safe, or they might even be a danger to others. If they are under 18 and the parent or caregiver is unable to be reached to make medical decisions for them, then it is up to professionals to step in and make those decisions until a parent or caregiver can be found. This is where the mental health crisis hold comes in. What is a mental health crisis hold? In the past, this process has been called L2K or legal hold or legal 2000. However, during recent legislative sessions, the official name has been changed to reflect exactly what it is, a mental health crisis hold. With a mental health crisis hold, a youth who is in crisis and there is not a consenting parent or guardian can be held for medical treatment involuntarily for up to 72 hours. When can a mental health crisis hold be started? When a youth is a danger to themselves, a danger to others, or is unable to care for their basic needs due to mental health symptoms and the parent or caregiver is unable to be reached. The hold is meant to protect the minor in the absence of a parent or guardian who can give consent for treatment. A few examples are a depressed youth who attempted to end their life by suicide, or a youth who has refused to eat and drink for days because they think someone is trying to poison them, and they are at risk of serious injury or death resulting from not eating. In both scenarios, if the parent or caregiver is unable to be reached, then certain professionals may make a decision to start the mental health crisis hold, such as psychiatrists, psychologists, social workers, nurses, and law enforcement officers. Here in Nevada, we use a legal document called the Mental Health Crisis Hold Packet, which consists of 4 main parts. The first step in the hold process is for one of those specific professionals to begin the hold. The 72 hours starts at the date and time the first section of the hold is finished. Here, the professional must also document their attempts to contact the parent or guardian and the results. Professionals should be detailed in describing the youth's behaviors. For example, a youth who is suicidal. Instead of writing, "the child is suicidal," they might say, "the youth stated they have nothing to live for, they attempted to hang themselves, they have given away their belongings and left a goodbye note for friends and family." The youth in crisis will be taken to a hospital or mental health facility. When a youth on a mental health crisis hold arrives at the hospital will need to check them for safety, determine if they have any serious medical needs that require immediate treatment, and continue to try and contact the parent or guardian. This is the second step in completing the hold and is titled the Medical Examination section. This is done by a licensed medical professional who is confirming the youth is or isn't medically stable. The third step is an assessment by a mental health professional to see if the youth meets the list for a mental health crisis as understood under Nevada law. In the legal hold packet, the section is titled Certificate for Emergency Admission to a Mental Health Facility or Hospital. This section says that specific medical or mental health professionals have checked the youth and agree that they need to be on hold for their own safety or for the safety of others. So what can someone expect during the 72 hours? While at the medical facility, they will be placed in a room that is safe. The healthcare team will continue trying to find the parent or caregiver while meeting with the youth to figure out their emergency medical and mental health needs. At any point in the process, if the parent or guardian is found, the hold will be stopped so the parent or guardian can make treatment decisions for the youth. This is called decertification and is the 4th section of the packet. If a consenting parent or guardian is still not found and the youth is no longer a danger to themselves or others, the 4th part of the form can be completed by specific health professionals. This section is called Certificate of Release of Person on a Mental Health Crisis Hold. When a youth is no longer a risk to themselves or others within the 72 hours, the healthcare team will help connect them to outpatient mental health services and begin getting them ready to leave the hospital. This could include contacting a Child Protective Services agency. Many youth will not need to go to a specialized psychiatric hospital, but for those that do, the process can take anywhere from several hours to several days. If at any time during the mental health crisis hold process a youth or their parent or guardian are worried their civil rights are being ignored, they can contact the Nevada Disability Advocacy and Law Center at 1-888-349-3843. We hope this brief video has helped you to better understand the mental health crisis hold process for minors in Nevada. For more detailed information and resources, brochures can be found at nvbh.org/involuntary-hold. Nevada strives to protect a youth's rights and provide caring treatment during a mental health crisis. Helping people, it's who we are and what we do.